So we told about blood pressure details and how the blood pressure produced. In our previous course, we told about this. Now, we will look at the details of blood pressure measurement. So fluctuations in blood pressure recorded over the frequency range of hearing are called sounds. And the sources of heart sounds are vibrations set up by accelerations or decelerations of blood. The function of blood circulation is to transport oxygen and other nutrients to the tissues of the body and to carry metabolic waste products away from the cells. We know that. And blood is pumped around the body by the heart. It makes a way around the body through a network of tubes known as vascular system. Together with the heart, they form a cardiovascular system. So to remind you, I add that. This part is an introduction. So we know that vascular system has three subsystems: arteries, high pressure arterial tubes that carry blood away from the heart, capillary network, thin walled tubes that allow transfer of nutrients and oxygen into the cells, and the removal of waste products from the cells, and the veins, which are low pressure tubes that return the blood to the heart. And then I have included an important summary here, but these are for just reminder purposes again. You already see these in your other lessons. I also summarize it for you in our previous lesson. Look at that, please. We have red numbers on the right figure. So when the left ventricle contracts in the response to the electric stimulation of the myocardium to the left ventricle, ejects blood through the aortic valve into the aorta. The exchange of nutrient material takes place at the capillary level at second part. So at the third, the blood then returns to right atrium, then the right ventricle. And the fourth stage, the blood is pumped from the right ventricle into the pulmonary artery through the pulmonary valve. And then at the fifth part, at the pulmonary capillaries, oxygen diffuses from the lung alveoli to the blood, and then carbon dioxide diffuses from the blood to the alveoli. At the last, at 6, the blood flows from the left atrium and the filling chamber of the left heart through the mitral valve into the left ventricle. So this is a summary for it. So let's look at some other things. SP is systolic pressure, DP is diastolic pressure, and we have mean pressure, MP. What are these? We will look at again, but initially I want you to see the details, numeric details about the systolic pressure and diastolic pressure. So these are typical values of circulatory pressures. Systolic pressure and the diastolic pressure. Look at the arterial part, please. Systolic pressure is between 90 and 150 millimeter of mercury. For pulmonary artery, it's around between 20 and 30 millimeter mercury. So look at left ventricle and right ventricle. For the left ventricle, it changes between 90 and 150 millimeter of mercury. Look at right ventricle, it changes, it's smaller, it's between 20 and 30 millimeter of mercury. For the diastolic pressure, they have smaller values actually for the different parts of the arteries and pulmonaries. So the diastolic pressure, arterial diastolic pressure is between 60 and 80 millimeter of mercury. Look at that, please. For the pulmonary artery, it's between 8 and 12 millimeter of mercury. So wedge pressure, which is intravascular pressure that is measured by means of catheter wedged into the pulmonary artery. So it is to block the flow of blood that is equivalent to the pressure in the left atrium, also called pulmonary capillary wedge pressure or pulmonary wedge pressure. So the electric, by the way, mean pressure is MP for the right atrium. Look at that, please. It's between 2 and 6 millimeter of mercury. For left atrium, it's between 6 and 12. So the electrical impulse causes contraction of ventricular muscle and generates ventricular pressures. So this force blood through the pulmonary and aortic valves into the pulmonary circulation and systematic circulation. And these kind of pressures will be produced. Now, so systole and diastole. A single cycle of cardiac activity can be divided into two basic phases. These are systole and diastole. During the contraction phase, so systole, contraction phase, systole, blood is ejected from both the left and the right ventricles and pumped into the systemic circulation and pulmonary circulation respectively. So contraction phase, systole. So diastole. During the relaxation phase of the heart, diastole, the ventricles are filled with blood pressure for the next contraction phase. So according to cardiac cycle, we will have, according to time, pressure values, if we can measure this. Now, let's look at the systolic pressure and diastolic pressure details. Initially, the cycles of ventricular contraction and relaxation lead to maximum systolic and minimum diastolic levels of blood pressure in the major arteries in which blood is initially pumped. So generally, we may record using systolic and diastolic pressure measurements. Blood pressure is reported by these. For example, 122/70 is systolic pressure of 120 millimeter of mercury and diastolic pressure of 90 millimeter of mercury. Now, we have pressure versus time graph for systolic and diastolic pressure. Let's make some explanation for these. So this figure shows us the arterial blood pressure fluctuations. And as you see, we have 5 peaks. So this figure shows us 5 atrial blood pressure beats actually, and some usual properties of these. Look at that. For one arterial blood pressure beats, we have 1 second interval. So atrial blood pressure is measured in millimeter of mercury, if we know this anymore. The systolic pressure corresponds to maximum level of millimeter mercury reached in 1 beat, while the diastolic pressure is defined as a minimum level of millimeter mercury reached in a 1 beat. So a person's arterial blood pressure is usually expressed in terms of the systolic pressure over the diastolic pressure, so as in the 120 by divided by 70. So 120 to 70, we generally express by using this term. Or as you see in this figure, in the first beat, the patient has 120 to 80, which is a typical blood pressure. The systole is the period of time when the heart contracts itself to send the blood to the rest of the body. And this explains why pressure increases during the systole, and diastole is the period of time when the heart refills with blood. Between the systole and the diastole, there is a brief interruption of smooth flow due to the short backflow of blood caused by the relaxation of the ventricle. And this is called dicrotic notch. And you can see this in the figure. Now, systolic and diastolic blood pressure are important measurements and have tremendous diagnostic value as shown in the table. Look at the figure, please. We have some normal values. We have some values for hypotension and hypertension. As you see, normal values of diastolic pressure between 60 and 79, and for the systolic pressure it's between 90 and 119. For smaller than the normal, if these values are smaller than the normal, this is hypotension. Look at pre-hypertension values. Diastolic pressure is between 80 and 89, and systolic pressure is between 120 and 139. So stage 1 hypertension and stage 2 hypertension values are also seen on the table, which are which are valuable for diagnostic purposes. So the mean arterial pressure that drives through the vasculature from the arteries to the arterioles, capillaries, veins, and back to the heart, the mean arterial pressure is the time-weighted average of pressure values in large systematic arteries during the cardiac cycle. So the ventricles spend approximately 1/3 of their time in systole and 2/3 in diastole. So the mean, we have an equation here for the mean arterial pressure. So 2 divided by 3 diastolic blood pressure and 1 to 3 systolic blood pressure, and summation of these two will give us the mean arterial blood pressure. So we will take the diastolic blood pressure values 2 divided by 3. So we will multiply the value by this value. Also, we will take the 1 divided by 2 value, or 3 to one value of systolic blood pressure by using this equation, and this will give you the mean arterial pressure. So we can say, as a result of this, mean arterial pressure is a function of the rate at which the heart pumps blood into the large arteries and the rate of blood flow out of the large arteries to enter smaller arteries and arterioles, and the arterial wall compliance. So these are the mean arterial pressure is a function of this. The pulse pressure, the difference between systolic and diastolic pressures. Another definition: mean arterial pressure and then pulse pressure. And the systolic and diastolic arterial blood pressure values important in diagnostic level. I added here some link of some videos for blood pressure measurement in clinical examination, and also how you can understand blood pressure measurement monitor readings. You can see these in these videos. Please look at them. Now, another thing, heart sounds and murmurs. Auscultation of heart gives the clinician valuable information about the functional integrity of the heart, and then heart sounds are vibrations or sound due to the acceleration or deceleration of blood. Murmurs are vibrations of sounds due to blood turbulence. Okay, I will take the attendance one more time. After that, I will go on. Wait, please. I have 30 students now. Okay, thank you. Yes, murmurs are sounds, vibrations or sounds due to blood turbulence. Okay, we have a figure here. Look at that, please. We have laminar flow refers to streamline movement of blood. In laminar flow, blood flows in layers which move parallel to the long axis of the blood vessel. So straight arrows parallel with the vessel long axis, as you see. So constriction of vessel or obstruction of vessel lumen disrupt laminar flow and leads to turbulent blood flow. This is shown in the illustration by curved arrows and short straight arrows showing flow in directions other than along the axis of blood vessel. At the point of constriction, blood flow velocity increases, but the small eddies lead to flow in directions other than parallel to the long axis of the vessel. So such current eddies will cause turbulence. Okay, turbulence is that. So murmurs are vibrations due to blood turbulence. Now, heart sounds. Look at classical electrocardiography graph. So PQRST. At the bottom, you will see that. So as a result of the contraction, relaxation phases of the heart, we can obtain this electrocardiography graph. So we can also have some sounds. So look at that, please. First, fourth, first, second, third, again, fourth. So there is a cycle like that. The first heart sound is associated with the movement of blood during ventricular systole. The second heart sound is low frequency vibration associated with the deceleration and reversal of flow in the aorta and pulmonary artery and with the closure of the semilunar valves. So this second heart sound is coincident with the completion of T wave of the electrocardiography. Look at this T wave, please. Okay, so second heart sound so is coincident with the completion of T wave. The third heart sound is attributed to the sudden termination of rapid fill-in phase of the ventricles from the atria. The fourth or atrial heart sound is not audible but can be recorded by phonocardiogram. It occurs when atria contract and propel blood into the ventricles. Yes, let's go on with the murmurs again. So most murmurs are developed by turbulence in rapidly moving blood. Murmurs during the early systolic phase are common in children, and they are normally heard in nearly all adults after exercise. The abnormal murmurs may be caused by stenosis and insufficiencies, some leaks at the aortic, pulmonary, and mitral valves. They are detected by noting the time of their occurrence in the cardiac cycle and their location at the time measurement. About murmurs, I added here a YouTube video. Please watch it. Now we have 1, 2, 3, 4 area here, for example, why we have these areas. Now let's look at these. By the way, this figure is from the video. For example, it will explain you the murmurs of aortic stenosis. I don't have time to watch this video with you because of this. I only added the link here. Now, let's go on. Auscultation techniques. Heart sounds travel through the body from the heart and the major blood vessels to the body surface. Because of the acoustical properties on the transmission path, sound waves attenuated and reflected. We know that it's possible there will be some attenuation. The amount of the sound energy will decrease. The largest attenuation of the wave-like motion occurs in the most compressible tissues such as lung and fat layers. There are optimal recording sites for the various heart sounds, sites at which the intensity of sound is the highest because of the sound being transmitted through the solid tissues or through a minimal thickness or inflated lung. So sound transmission changes, transmission velocity changes according to tissues. In air, the velocity of sound small. It's 5 times higher than in liquids. It's 20 times higher than in solids. And also our tissues have their own acoustic impedance values. So because of this, it can change. So we can say, according to properties of sound, according to properties of tissues, there are 4 basic chest locations at which the intensity of sound from the 4 valves is maximized. Okay, so 4 important points. They are auscultatory areas. So these areas on the chest, A is aortic. We have P, as you see, P is pulmonary, and T is tricuspid, and the last one, M, is mitral areas. Stethoscope. Stethoscopes are used to transmit heart sound from the chest wall to the human ear. Some variability in interpretation of the sound stems from the user's auditory acuity and training. Stethoscope acoustic reflected the acoustics of the human ear, and younger individuals have revealed slightly better responses to the stethoscope than their elders. The mechanical stethoscope amplifies sound because of standing wave phenomenon that occurs at quarter wavelength of the sound. How stethoscope work? So the diaphragm is the bottom side pictured in the image on the right side. Look at the figure, look at the picture, please. It is basically a plastic sheet that transmits vibrations from your skin and delivers them via the tubing to the listener's ears. It is this side you have to use to hear medium, high-pitched sounds. On the other hand, the bell side is just the chamber that forms between the chest piece and your patient's chest. So the change in volume of this chamber as a result of, for example, heartbeats causes the sound waves to travel via the tubing to the listener's ear. So you can use this side for low-pitched sounds. Yes, some details, some issues with stethoscope. So when the stethoscope chest piece is firmly applied, low frequencies are attenuated more than high frequencies. The diaphragm becomes taut with pressure, thereby causing an attenuation of low frequencies. Loose fitting earpieces cause some additional problems because the leak that develops reduces the coupling between the chest wall and the ear. So with a consequent decrease in the listener's perception of heart sounds and murmurs. Stethoscopes are also useful for listening to the sounds caused by airflow obstruction or lung collapse. So the electronic stethoscope have selectable frequency response characteristic ranging from the ideal flood response case and selected band passes to typical mechanical stethoscope responses actually. The physicians, however, have not generally accepted these electronic stethoscope, mainly because they are unfamiliar with the sound heard with them. They still use the other one. Okay. They still use the mechanical stethoscope. Indirect measurement of blood pressure. So this is an attempt to measure the intra-arterial pressures non-invasively. The most standard manual techniques employ either the palpation or the auditory detection of pulse distals to an occlusive cuff. So this is a schematic, this is a figure shows you the indirect measurement of blood pressure that I show you now the details. So, sphingomanometer consisting of inflatable cuff for occlusion of the blood vessel and a rubber valve for inflation of the cuff. And the either a mercury or a manometer for detection of pressure. So these are the parts, okay? Rubber cuff we have, and then we have a bulb part, as you see. These are basic parts of sphingomanometer. The occlusive cuff is inflated until the pressure is above systolic pressure, then is slowly bled off. For example, 2 to 3 millimeter of mercury per second. When the systolic peaks are higher than the occlusive pressure, the blood spurts under the cuff and causes palpable pulse. The wrist actually, palpable pulse, the wrist. So basic measurement technique in this indirect measurement is like that. Another explanation for the same thing. Look at this figure, please. Cuff pressure, systolic pressure, arterial blood pressure pulses, diastolic pressure. So in this typical indirect blood pressure measurement system, the sphingomanometer cuff is inflated by hand bulb to pressure above the systolic level. So the pressure is then slowly released, and blood flow under the cuff is monitored by microphone or a stethoscope placed over the downstream artery. So the first Kritkov sound detected indicated systolic pressure, whereas the transition from muffling to silence break at diastolic pressure. The main logic in the measurement is like that. So as a summary again, in a different view. So the systolic normal blood pressure and diastolic blood pressure values. So blood pressure cuff is wrapped around the arm and inflated until blood flow is stopped. The examiner listens for arterial sound as cuff is deflated. Pressure at which sounds are first heard is recorded as the systolic pressure, and the pressure at which sounds no longer heard is recorded as the diastolic pressure. So this is the most developed one, and it's actually same with this. So how do we determine systolic diastolic pressure in this measurement system? So the pressure in cuff, you can see blue line in the top. You can see it as blue line in the top. So the pressure in the cuff is initially raised to a value above the expected arterial systolic pressure. So this pressure is red line in top panel. This will ensure complete obstruction of flow in the branchial artery. So the cuff pressure is then gradually reduced at a rate between 2 to 3 millimeter of mercury per second. At all cuff pressures above the systolic pressure, flow in the brachial artery remains obstructed. However, as soon as the cuff pressure falls below that of the peak systolic pressure, a small volume of blood is forced through the obstruction. The vessel contraction caused by the pressure cuff causes flow of this volume blood to the turbulent, and the turbulent flow causes tap-in sound known as Kritkov sound. So it can be, this Kritkov sound can be heard by the stethoscope. So we can say Kritkov sounds are the sound that medical personnel listen when they are talking blood pressure using non-invasive procedure. We can say this Kritkov sound is that. So if the pressure is dropped at a level equal to that of patient's systolic blood pressure, the first Kritkov sound will be heard. As the pressure in the cuff is the same as the pressure produced by the heart, the same blood will be able to pass through the upper arm when the pressure in the artery rises during systole. So the blood flows in the sports as the pressure in the artery rises above the pressure in the cuff, and then drops back down beyond the cuffed region. So resulting in turbulence that produces an audible sound. This is the definition of it. So how the blood pressure inside the cuff, pressure inside the artery. So according to systolic blood pressure and diastolic blood pressure during the measurement process, how these critical sounds detected by the stethoscope, this figure shows you. So if the pressure is dropped to a level equal to that is of the patient's systolic blood pressure, the first critical sound can be heard. Okay, that's all for today's course. As I said, if you watch the videos I added to this presentation, you can understand better. Also for the critical sounds, you can find really detailed videos that explain it to you, that explain the stage to you. But these are the most important parts, the things that I told you, the summary of these processes for the blood measurement systems. Last time I will take the attendance. Okay, thank you. I will also upload this video on YouTube for you, and I will share the link on our group. Thank you.